Hi, I want to provide some guidance for women considering pregnancy or those who are pregnant during the COVID pandemic. The good news is there's no evidence to suggest you should avoid pregnancy or that pregnancy during the pandemic is unsafe. If you are planning for pregnancy soon, be sure you're taking a multivitamin, a folic acid supplement, or a prenatal vitamin daily. We do know pregnant women may be at higher risk for severe symptoms if they develop COVID. Like the general population, conditions such as obesity, hypertension, and diabetes may put pregnant women at higher risk for severe complications. Definitely follow recommendations of your healthcare provider, but there is no better time than pregnancy to focus on a healthy diet and exercise. Also, working to manage your blood sugars if you're diabetic and your blood pressure if you have hypertension are going to be key to having a healthy pregnancy and reducing the risk of severe disease if you contract COVID. As we approach flu season, if you are pregnant or considering pregnancy, it's extremely important that you get a flu shot. Pregnant women are considered a high-risk group for severe respiratory disease and death related to the flu. This is largely preventable with the flu shot. In terms of preventing the risk of transmission of COVID, pregnant women should follow the precautions we have all heard. Follow the prenatal visit schedule recommendations from your providers. Wear a mask in public and when social distancing is not possible. Frequent hand washing and social distancing is critical. Avoid social activities that are not absolutely necessary to reduce your risk of exposure. Consider shopping and dining options that allow for minimal contact with others. Your provider and their facilities are also working hard to keep you safe during this time. Symptom screening is a common practice in provider offices and hospitals. Provider offices have implemented infection prevention strategies such as social distancing in waiting rooms, stringent surface and room disinfectant practices, and mask requirements. Some offices even offer an electronic check-in process that minimizes contact. Many physician offices now offer telehealth options for your prenatal visit to help limit your exposure during times in your pregnancy when it's safe. Finally, patients with respiratory symptoms worrisome for COVID are often seen in a separate location or area in the office or hospital to keep everyone safe. At this time, there is not reliable data that COVID is transmitted to the fetus or through breast milk. Pregnant women who have symptoms concerning for COVID should contact their healthcare provider and consider testing. Even if you're concerned about a respiratory infection or COVID, breastfeeding is safe. While you wait for recommendations from your healthcare provider about your respiratory symptoms, wear a mask while breastfeeding your baby and be sure to wash your hands before and after touching the baby. When you're not breastfeeding the baby, keep the baby at least 6 feet away from you at all times. Be sure to elicit the help of other family members and friends. Planning for pregnancy and expecting a new baby is an exciting time. While the COVID pandemic has changed how we go about our day-to-day life, there is some solace in knowing that continuing the basic precautions such as wearing a mask, social distancing when appropriate, and frequent hand washing can keep you and your baby safe. Thank you.